COVID-19 has been stressful for so many people, like those who are most susceptible, children, and first responders who are on the front line amid this public health crisis. The Virgin Islands Department of Health has a few helpful tips for coping. Only get your news from reliable, trusted sources, but be sure to take a break from watching or reading the news when it becomes overwhelming. Maintain your healthy lifestyle by eating a balanced diet, exercising regularly, and resting well. Avoid abusing alcohol and take deep breaths to manage stressful moments. Practice social distancing, but find other ways to connect with your loved ones and be supportive when they need you most. Practice good hand hygiene, make time to unwind, and enjoy your favorite hobbies at home. And take control of your health and well-being. If stress becomes overwhelming, speak to your healthcare provider. Visit doh.vi.gov for more information on how to cope.
The Atlantic hurricane season begins on June 1st and lasts through November 30th. Please take necessary steps to protect you, your family, and the community.
Begin collecting supplies such as bottled waters and non-perishable food, batteries, radios, games for children.
Don't forget about your pets and especially your elderly family. Take time now to trim trees, install or check shutters, talk to children about hurricanes and allow them to pack their own go bags.
These activities can help reduce anxiety in the event of a storm. We're a small community.
Together we can ensure our islands, homes and families remain prepared for hurricanes.
Register for Alert VI emergency notification by visiting vitema.vi.gov. Make a plan.
Be prepared.
Stay informed.
Together, we are making progress against COVID-19 and getting our active lives and economy going again. As businesses unlock their doors and restock their shelves, you remain safer at home. But if you must go out, use the government's guidelines to stay safe. Wear your face covering when entering a business. No face covering, no service. Use hand sanitizer before entering and when leaving a business. And stay at least 6 feet apart. Practice social distancing. Safer at Home USVI is step 3 in our path to a new normal. We're depending on you to do your part. For more information, visit www.vi.gov.
Good afternoon, Virgin Islanders at home and abroad. I trust that you had a very restful weekend. Today, we are currently tracking 2 active cases of COVID-19. That's good news for us in the territory, only 2. We have tested 1,348 individuals for the virus in the territory. 1,272 of those tests came back negative. 69 were positive, and seven tests are currently pending. So we've been maintaining that 69 number for quite some time now. Currently, we have no COVID positive patients at the 1F Louis Hospital and 1 COVID positive patient at the Snyder Regional Medical Center on St. Thomas. That patient is still on a ventilator. The sailor that we gave rescue to, he is still fighting for his life, and his prognosis is better than it was when he first arrived, and we continue to root for his full recovery. The staff at Snyder Regional Medical Center are doing a fantastic job with his care. Thank you so much, all those nurses, doctors, administrators over there. I ask that you, our Virgin Islands public, keep him in your prayers as he fights through this virus. This is the second week of our Safer at Home, and so far so good. I know a lot of you had a lot of trepidation and fear going into this phase, but so far we haven't really had any coronavirus positives as a result of our opening up. The one coronavirus case we recorded was from the sailor who we have in the hospital at this time. I want to thank all of you in the public for your continued cooperation in adhering to the masking guidelines, all the stylish masks we have out there, the measures that we have undertaken, that we have taken under the advice of our health experts have proven successful thus far. Most places in the United States do not have a mandatory mask, no service. You see those signs all over now. So I think we're doing a good job of getting that out there and making sure that we don't have this spread. We will be monitoring, of course, for the next 2 weeks as we prepare to open up and for our path back to the new normal. As you know, that is anticipated to be June 1st when we will breach yet another step of this reopening process. But I want to remind the public that if we see any significant decline in the progress that we have made thus far, we will definitely be backtracking and reassessing our opening on June 1st. But right now, we remain on track. We'll be meeting later this week to once again discuss and hash out, I call it the war room, where we decide what are those parameters going to be finally going into June 1 and the green phase. So if we have to, we can always go back. This is a good thing about this process. We haven't been through it before. This is the first time for everyone. So there's always a chance to refer back to safer at home. We continue to make strides in our economic response to the pandemic. To date, the Department of Labor has received 8,074 applications for unemployment benefits and 5,208 checks have been issued for a total of approximately $3.7 million. We also have good news on that. We are hoping by the end of this week, we'll be able to start to add that extra $600 onto the check, and those checks will start to come out. So you'll get your regular unemployment, and then you would get the extra $600 as part of the CARES Act. As of this morning, the Virgin Islands Water and Power Authority, under the YES CARES Act, the Your Energy Stimulus, has issued $250 credits to 10,492 of you out there in the public. Those are ratepayers getting that $250 credit as a result of this energy stimulus. And $500 credits, we've issued 2,397 to our commercial ratepayers, for a total of just under 13,000 ratepayers in the territory that have now benefited from this stimulus act. Like I said before, this credit will be on your bill until it is used up. So if you paid your bill already and you didn't get the benefit of the credit this month, you will get it next month. It'll just stay on there until you use all of that. We are churning along with our stimulus checks. So far, 6,271 checks have been mailed out, totaling just about $10 million. The Department of Finance has already started batching another $10 million to be mailed out this week, and we will continue to churn that out as quickly as possible, getting that into your hand. I also have the state director for AARP here with me today, because I want to announce that we, through the tireless efforts of the administration, the delegate, and certainly the powerful lobbying effort of the AARP, the Social Security Administration has agreed to share the data with us from their recipients that will allow so that now Social Security recipients don't have to file a tax return for 2018. We have not gotten the data yet. But we're sure that it'll be coming probably by the end of the week. We will not be able to do it electronically. They don't want to share the banking information, but we will get the mailing addresses and be able to get that out. I would certainly like to thank Schuster, the VI State Director, who's going to share some words for you after I'm finished, and the entire AARP membership, of which I'm a happy, proud, card-carrying member, for making this possible. Like I said, we're still awaiting the final little details from Social Security and the listing with everybody, but this is fantastic news. I know a lot of you in the community, it caused a lot of angst over having your seniors come out there and fill out Social Security, withholding papers. So this is a big win for the entire team. I want to really thank the AARP. So while the entire world is reeling from this global pandemic, thus far in the Virgin Islands, we have been very fortunate physically, as the pandemic has had a minimal effect on the overall health of our community. We have also been very fortunate to have received much needed support from the federal government. A lot of that support has come individually, as well as for businesses. The payroll protection program, the stimulus checks which are going out now, the unemployment insurance which is going to go out, the Yes Energy subsidy for your WAPA bills. They're all programs that many of our sister islands could only hope for. We have gotten more money already for the coronavirus response than some of our islands have gotten for their hurricane response. We are making progress, but as a territory, we are facing dire financial times. Our revenues are down, as could be expected, and we have joined the delegate and other governors, mayors, and political leaders in lobbying Congress to bring some relief to state governments. The HEROES Act, I'm sure you've heard about it. It is supported by our administration, certainly our champion, the Delegate Plaskett in DC. It has passed the House. And that bill proposes to allocate $2.25 billion in direct funding to the territory, along with other benefits as well. But it still has to be approved by the Senate before it can be passed. But they cannot act fast enough on this bill. As we all know, our revenues are way down and we need the help. This is much needed aid, and it would go a long way towards the financial tsunami that is mounting as this pandemic continues. As I've said before, no one seems to have a good grip on how long this will last or if the virus will resurface in the fall. We must be conservative in all our ways, especially in spending our money, whether it is general fund or federal fund dollars. We can't start spending too soon and not have enough money to last us through the entire pandemic. All the problems that we had before this pandemic, those problems have not gone away. Last week, GRS issued a letter to me recommending a 42% cut in benefit payments. Clearly, this is not an option. While we cannot fix the entire GRS situation in one fell swoop, we do have things that we can do. We have pending legislation in the Cannabis Act that will start to chip away at the problem. We continue to work in Washington to identify a funding source for the GRS. And we continue to lobby to get the cash infusion needed for the gasoline tax at Hovensa. But these things are not in our control. They are up to the federal government. We must act on the things that are in our control. We have listened to the concerns of the public and our senators and have included them in the new draft of the cannabis bill. I am urging the legislature to act swiftly and pass this revenue measure as soon as possible. We all know that revenue measures are hard to come by, but this is one we can act on now. There is so much to do, and we are getting it done. It is an incredible balancing act to manage the recovery, the current budget crisis, and this pandemic, which is far from over. You know, this weekend as I toured the island, watching many of you gather on the beaches and your children play in the water and the surf, the state of emergency and the coronavirus pandemic seems so far away. It almost seemed normal. Let me assure you, it is not. While we understand that you seek to find a new sense of normalcy, these are not normal times. We are in a state of emergency, and I will continue to caution you, do not take this virus lightly. We have all witnessed how deadly it can be. Stay vigilant. Remember, you are always safer at home. Stay safe and stay sanitized. I have, like I said, the State Director of the ARP who would like to share a few words with you as we thank him for their involvement on a national level, as well as all that they do here on a local level. Mr. Schuster.
Thank you, Governor Bryan. Good afternoon, Governor Bryan and Commissioner Encarnacion. Good afternoon to the listening audience, and especially good afternoon to all of the AARP members in the territory. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people to choose how they live as they age. With nearly 38 million members and offices in every state, Puerto Rico, and the U.S. Virgin Islands, AARP works to strengthen communities and advocate for what matters most to families. With a focus on health security, financial stability, and personal fulfillment. AARP's social impact work, our advocacy, is at the heart of all we do. Since the onslaught of the COVID-19 pandemic, AARP has been fighting hard at the national level on a wide array of issues, including working to ensure that older Americans, especially those living on Social Security, are eligible for the full $1,200 relief payment that everyone else will receive. We recently discovered that Social Security beneficiaries living in the territories who are not typically obligated to file income tax would have to file their 2018 taxes in order to receive the economic impact payments, otherwise known as stimulus payments. We believe that this is unusually burdensome, especially during a pandemic, which places older people at higher risk. We also believe it is unnecessary given that Social Security Administration maintains the necessary 1099 data on Social Security beneficiaries living in the territories. Social Security Administration sharing this information with the local tax authority should alleviate the need for them to file taxes to receive their payments, as was the case for our fellow Americans on the mainland. AARP successfully fought to make sure those people who receive Social Security benefits but don't normally file taxes would be able to receive their payments automatically and without having to file additional paperwork. In our work to bring relief to Social Security beneficiaries living in the territories, on May 7th, AARP sent a letter urging the United States Treasury Department, which includes the IRS, to work with the Social Security Administration and local tax authorities in the territories to ensure all eligible Social Security beneficiaries receive their relief funds as soon as possible and in a simple and straightforward manner. We urged that Social Security beneficiaries in Puerto Rico and the U.S. Virgin Islands, like all other Americans, should receive their payments automatically and not be unduly burdened by having to file additional paperwork. AARP also sent a letter on May 12th to the Commissioner of the Social Security Administration, urging SSA, the IRS, and the United States Treasury to work with local tax authorities in the U.S. territories to help identify all eligible Social Security beneficiaries living there. In several recent communications from SSA regarding the territories, including a response to AARP's letter on May 15th, SSA indicated to us that they have worked and are continuing to work to make sure the IRS has all of the data for Social Security beneficiaries, including those living in the U.S. Virgin Islands. And the IRS will be sharing that information with the territories so that they can make economic impact payments. Again, AARP is confident that the IRS has or will share the data that it needs to with SSA in order to identify Social Security beneficiaries, including those living in the U.S. territories. On behalf of our 22,000 members in the Virgin Islands and all Social Security beneficiaries, AARP thanks Governor Albert Bryan Jr. for his diligence in ensuring that those living on Social Security in the territory do not have to file 2018 taxes, and that these individuals will receive payments quickly and automatically. We are very happy that in doing so, Governor Bryan has worked to bolster their financial security and protected their health, keeping them safer at home during this pandemic. Governor Bryan, thank you again.
Thank you, Troy, and thank the AARP. If you haven't got your membership card yet, and you know you're over 40, you need to do it. It comes with a lot of benefits. Don't be in denial like many of my friends. You know, they don't even want to wear glasses, but we know what's going on. I also want to. We have seen you out there wearing those masks, and not all of you are wearing them properly. So, you know, Commissioner Encarnacion is very, very concerned about your health and welfare. I've seen people wearing these things upside down. You know, you got to be very careful in putting on your mask and making sure that you don it properly. So we have our commissioner here to give you some tips as well. Again, Commissioner Encarnacion.
Good afternoon, everyone. Not only putting on the mask, is actually taking off the mask sometimes is most critical. And so, first of all, thank you, Governor and Mr. Justa, for the information that you shared today. It's important that when you take off your mask, you make sure that you take it off, but you're not touching the outside of the mask. And we had our safety officer, Kathleen Lewis, here teaching you that. We're actually going to bring her back so she could continue doing that teaching. Doing one episode of that, I think we need a little bit more. So remember, as you take your mask off, you actually take your mask, you don't touch your front, and you put it down, you put it in a plastic bag, and you put it in your bag, so when you need it again, you have it. And of course, not just putting your mask and taking it off, but washing your hands, using hand sanitizers. There's another aspect of that also. We're saying no mask, no service, and I think we're doing very good with that. We want to make sure that individuals who are lined up outside are also taking heed to social distancing. So what we're seeing, our health officials as well as our environmental health team as we go around, we're seeing that you're actually putting your mask on to go inside, but prior to that, you're staying close to each other outside. And we know that coronavirus, the COVID-19, it seems as though every week we hear something different, something new about it. And so because of that, one of the things that we're hearing now is that speaking loud, singing, coughing, of course, is one of those things. And how long does it stay in the air around you? We're not quite sure. So that's why that 6 feet social distancing is so important. We want you to continue to do that, as the governor said. Do not put your guard down just because we haven't seen positive cases within a few days. We're still indicating, we're still testing, and we want to make sure that if you have any signs or any symptoms related to COVID-19, and including cough, symptoms of a cold, aches and pains, gastrointestinal or diarrhea, vomiting, anything related to that. Of course, with children, looking at inflammatory diseases coming to us that we did not expect or see before. So any of those are reasons why you should call 340-712-6299, 340-712-6299, or 340-776-1519. Another reminder, we're now going to be giving out guidances and public health notices as well to the public. One of the ones that we're looking at right now is dentistry. Dentistry, of course, you know that when you sit in a dentist chair, you have a lot of spraying. And so we're asking dentists to be very careful, because we don't want to, it's not just about protecting the community that's coming in, but it's also protecting the staff that you have working with you. So guidances will be shared, actually went out this morning. And so we're asking you to adhere to those guidances, protect your staff, protect yourself. And it goes back to, if you wear your mask, you're not just protecting others, you're protecting you. So all I ask is for you to be safe and keep the ones around you safe. God bless, and thank you.
So, I know usually the press asks all the questions, but I'll ask a question of the commissioner today. There's a lot of people wearing cloth masks. How should those be taken care of? Can you just leave them in the sun and they're good, or should you wash them every day? Any guidance on that as yet?
Well, you can leave them in the sun, but the best thing to do is to wash them. And that's why one of the recommendations from CDC says that you want to wear masks that are multi-layered. And that if you see the ones that actually have different layers to them. And let me show you this one actually. Hold it and put it in my bag. But let me show you this. This actually, the mask that's there. So when you actually can wash this mask, I've actually washed it about 3 times. So I've taken it up, I fold it up, and I put it away. So when you wash it, it has to be sturdy enough, but it cannot be too thick that it inhibits you from breathing comfortably.
Yeah.
Okay.
Okay. Thank you for that, Commissioner. I'm sure we have questions from the press. We'll entertain those now, for sure. Good morning. Go ahead.
Good afternoon, Governor. I'm David Pierre Consulting.
Hey, Ernest. How you doing?
Questions there. Good. Last week, OMB Director Jennifer O'Neill stated that the territory had 2 days cash on hand. Obviously, a while ago you mentioned the dire situation we're facing. If you could, Governor, explain what does 2 days cash on hand mean, and how much cash on hand do we have at present?
We still about 2 days cash in hand. Generally speaking, we look at that's about 7, maybe 8 million, but we have a little bit more than that because we just cut payroll for Thursday's payday for the government. So when you see that, I would say about $7 to $10 million on hand. Remember, we have ongoing bills coming in every day. We have managed to cut down on a lot of that due to the lack of movement really around buying stuff from the government. So we're just trying to control the cash as best as possible.
All right, thanks, Governor. I got a GS question, but I want to follow up on that. So you mentioned a while ago, of course, the Democrats in Congress passed their $3 trillion new stimulus package. Of course, that has to go through the Senate, which is controlled by the Republicans. You said $2.5 billion there is set aside for the territory. I know you're paying attention to the stateside politics as well. The Republicans are saying that is dead on arrival in terms of the amount. There are talks about how that funding should be utilized if indeed some go out. What if we don't see that money, Governor? What are the options there? Have you considered furloughs, or what are the belt tightening measures would the government undertake if we were not to receive the amount you mentioned?
Remember, that would just be, we were never counting on it, Congress to give us any money in terms of our budget crisis. Our budget crisis, we had been writing to our Treasury as well as to the President. We've been working through FEMA to get our disaster loans, our community disaster loans forgiven. They're about $300 million. Just the other day, I think we had a major figure in Treasury that actually recommended that we get that forgiveness of those loans. So that's really the first option for us, is trying to go out and getting those loans forgiven, and then being able to re-up and get about $200 million to take us through this fiscal year and part of next year. We don't want to go back and take the entire amount again, but we would hope that all of it would be available to us. So that is option A. Option B is, we know we're going to get some money for Congress, even though they said it's dead on arrival. It's highly unlikely that the United States government have funded the entire airline industry and all other sorts of stuff, and will not be giving any support to states and territories. It always amazes me from the ARA, if you remember, America Reinvestment Act, back in 2008-9, they give us all this money, and then it is so restricted that we can't do with it what we want. If you think about it, so far we've gotten $75 million the governor's discretion, another 6 for education, another 7 through DOI, and another $40 million through the Port Authority. We've gotten $87 million in stimulus, plus we've gotten there's another $20 million in there for education. And I'm just talking about the peripheral things off the top of my head. Our budget shortfall this year is $150 million. That's over $220 million that they've given us already. And they're saying you can't use it to balance your budget or to pay any debts that you had from before. So we're anticipating that we're going to get the money to do this. And just a slight correction, what was printed today, FEMA didn't deny our ability to for the $60 million. What they said was that there were provisions in the RAN agreement from the bank that they didn't agree to. And we didn't agree to those provisions as well. We know they weren't going anywhere. One of those provisions was any money would be from FEMA reimbursements would be used to pay off the debt, which we all know that couldn't happen. And there's another provision in there. But the banks are working through it with us. It's a negotiation process, so we continue to move forward.
Thanks, Gov. The banks are really asking for a lot. They want funds to be repaid via income tax, property taxes, and like Ms. O'Neill said, those items would have to be rectified through legislation. Do you believe the government will get that $60 million from the bank?
Yeah, I think we will get it. You know, the banks are concerned like everybody else because the first thing is when will this thing end? I mean, it's hard to lend people money. Suppose we don't get coronavirus relief until next June. Suppose it lasts a year. Right now, there's a lot of talk about treatments and there's talk about vaccines, but no one really has a clear picture of what it would look like in August or September or even December. So I think that is part of it. I think another that did us harm was the judgment by Judge Gomez, which wanted us to pay the $9 million a month to the GRS. We've gotten a little relief from that as well too. So banks want to be assured that they get their money back. And right now, it's a very uncertain time, not just for us, but for everybody. I often think of Puerto Rico, who's been totally shut down, even to construction for the last at least 60 days. They were already suffering from the recovery of the hurricane. Then they had the political upheaval. Then they had the earthquakes. And now they have coronavirus. They're in a way more precarious situation in terms of a government. And then I look to our sister islands like Tortola and Barbados, St. Martin. Those places don't have the ton of relief we're getting in terms of individual assistance, not only to our people in this form of unemployment tax, but also to our hospitals, our health centers, and to the government. So we're faring really well in the Virgin Islands. I thank God every day for the graciousness of being an American citizen, and that we're able to get some of that. And for the hard work we've been doing in Congress, our delegate and our lobbyists and all of us, our commissioners calling, our health commissioner, Darrell Johnson and FEMA, working to get these things done. Because I know sometimes it is people that say, Governor, you don't always sweat. Trust me, I sweat a lot, but it's 4 o'clock in the morning when I can't see. It's a lot going on. So we try to make sure that we're getting these things done. So we have Plan A, Plan B, certainly Plan C and D as we look at this fiscal crisis.
Okay, Governor, just I got one question for the Health Commissioner and two more for you quickly. You spoke of GRS there, and obviously they're looking to reduce retirees' annuities by 42%. You mentioned that already.
Right.
You said that's unacceptable, and you're lobbying for the legalized marijuana to a certain extent to, again, secure a bond. How long do you believe it would take to be able to secure a bond? The GRS is talking about 2021, which is 7 months away. How long do you think it would take from approval to implementation to being able to then secure a bond? Do you think it would be happening quickly enough?
Well, certainly it would be sometime next year, but we remain hopeful about some other things that we're doing. Certainly, right now with the coronavirus, every cloud has a silver lining, and there's a lot of talk about pension funds and the beating that they're taking. So it'll take us a little while in order to get that done. I mean, back in December, I was telling people we needed to get this cannabis bill done by January. We've already missed 4 months of revenue. We need to just act. There's also other measures that the legislature could take. There's an estate and trust piece of legislation that's in there that would help generate some revenue for us. So every single measure now we're trying to get done too, as well as the recovery. I'm trying to insulate us against the financial woes that will be following. I also anticipate that a lot of people will be coming home now once the travel gets back, because as they feel uneasy being in the States with this COVID crisis.
One more question for you, Gov, and the other is for the Commissioner. Gov, the last question for you is, as we move towards June 1st, which is when you intend to open up reservations for hotels, Obviously, we're going to see an influx of tourists. Like you said, not only folks want to come back home, but tourists want to leave the mainland, come in warmer weather here. Obviously, we might see an uptick in cases here. Have you been having, or the administration has had any conversations with the hotels in terms of safety, going beyond the normal just changing of sheets, but actually changing the under, making sure that the hotels are as safe as possible to help blunt the spread?
So, because, so I just want to make it clear, right? The hotels have already started taking reservations for June 1. They when we're saying we're open up, and that's a mistake I made initially too. If you say you're going to open up on June 1, they're going to have people making reservations for June 1. There are a couple of things that I want to say about that. The first one being is that we don't expect to have a bunch of people coming immediately. First of all, because our airlift is not there yet. It will take a certain amount of time in order for our airlift to bring in a substantial amount of people to the territory. The other thing is, as we gradually go, if you notice, our last executive order opened up travel to business travel and to staycationers, so hotels could start to practice how they're going to manage that. We've broadened our whole scope of testing to make sure that we have more tests and we can administer tests to people who may be in doubt whether they've been exposed to the virus. 2 weeks ago, we sat with the Hotel and Tourism Association, and they asked questions and gave us feedback on our plans to open up. Questions like, how many people would they be allowed to have in the hotel? How many people would be in the lobby? Would the decks and the pools be subject to social distancing? How would they operate on the beach, and what have not? So we've gotten a lot of feedback from them, and we have been looking at our rollout. The Department of Tourism, as well as the Department of Health, has been working on a complete plan for that. I could actually let the Commissioner comment a little bit more about that rollout.
So what we've done,
Okay.
like the governor said, we've actually met with the hotelier as well as Department of Tourism, the Assistant Commissioner, and as well as the Commissioner. And we've actually come up with a pretty stringent plan to roll out visits to the island as well as within the hotels. So we're being very careful with that.
Okay, thank you. Commissioner, this last question is for you, Governor. Thank you. In terms of the testing, and I know we have, over 1,300, you could correct me there, but in terms of the testing, I know a few weeks back, we said that the territory would have the capacity to perform 1,000 tests a day. However, while we've seen the number of tests go up, it hasn't been that drastic number. We've yet to arrive at the 2,000 number, and so I wanted to know what is going on there. When will we see a surge in testing to understand our situation here? And relative to the testing you've performed, have you included, or do you include repeat testing in there, in that overall number?
A few questions in there. So we did get the hologic, and that's the machine that allows us to test over 1,000 tests per day. We have received the reagents for that machine. We are actually waiting. We did all the validation tests. Now we're waiting for FDA to give us approval to actually use that machine, and that will be done hopefully by June 1st. We're looking at that. That is the expected date. We expected before, but we give a June 1st date for that. Yes, that will include repeat testing if needed with the guidelines, especially for healthcare providers. That's one of the things that we're looking at right now.
Okay, so you expect at least somewhere mid-June to be able to perform the mass testing, is what you're saying?
No, I actually didn't address mass testing. I did indicate that by June 1st, we were expected to get the FDA approval to utilize the machine. In terms of mass testing, we're developing a testing plan at this point in time, which could include mass testing. Of course, mass testing is conducted when you see wide community spread. We have not seen wide community spread.
Okay, and one clarification, the repeat testing, have we had any repeat testing in the tests we've had so far?
Yes, we actually had, and we had an interesting conversation this morning with Dr. Ellis. There's something that Brett Ellis, actually, the director of the lab, described it as viral wasting. And basically what it is that after 3 weeks, and he said you don't normally see it after 3 weeks, but you may see a positive test coming after 3 weeks, and it's not because the person is still contagious, but because it's a RNA, the ribonucleic acid, it's a RNA shedding. It is in the body, and it's shedding, and so, but not necessarily contagious. And but we are still being very cautious, because this is something that not only the VI, but nationally and internationally, they're now seeing more often. And so we're looking at that. Dr. Ellis is going to come back to us with more of a clarification once the epidemiology group nationally hears more information on that.
Sarah, I think I heard Sarah. You have a question? Good afternoon.
Yes, good afternoon, Governor, and the rest of the panel. Thank you for taking my question. It appears that we keep using the same fiscal practices which have yielded us negative results in the past. With our $200 million tourism product at risk, no cannabis bill in place to generate funds, federal dollars being specifically earmarked for projects, my question is, what is the plan to generate new revenue streams? If all we continue to do is borrow, this doesn't fix the situation but contribute to our fiscal crisis, Governor. And what my question is, bottom line is, what's the plan to turn this fiscal crisis around? Collectively, or just as a community as a whole, we continue to borrow, but that doesn't fix the problem, Governor. What can we do?
Well,
what's the plan?
I mean, there's a long-term problem and there's a short-term problem, right? I mean, the borrowing that we have to do now is definitely to get us out of the short-term problem. The long-term problem in terms of diversity is expanding into our marine division, as we did, introducing cannabis legislation, so we can start to have that revenue percolate in our economy. Because beside from the just general revenue that we create, there's going to be jobs, there's going to be withholding taxes, there's going to be equipment that has to be bought and maintained, there's going to be rent being paid, stores and shop fronts being open. Then you have our technology push that we're really looking at. RT Park has seen incredible growth in the last couple of years. We're doubling down on that effort. And of course, the recovery. We still have $400 or $500 million per year in capital projects that we have to invest in the economy. So there are a lot of different ways that we're doing this. Another one is the trust and wills. We have, I keep saying this, and people probably sick of hearing me saying it, but 89 people pay 66% of our revenues, a definite push in order to attract high net worth individuals back to the territory. Healthcare is a huge opportunity for us, as most of our populace is over 50 years now. We have continued to push our infrastructure and healthcare pieces. We should have the temporary hospital in St. Croix finished late this summer, and then we have the architectural and engineering RFP issued in order for the design and rebuild of that hospital. Myra Keating, I think the architectural and engineering is out for that as well, putting that back. So we still have a lot of construction projects that we continue to do. The expansion of our transshipment and cargo port, which we are taking a lot of licks on now because cruise ships are not in the Caribbean. Over half of all the traffic that comes through the Caribbean from the U.S. comes through the Virgin Islands. So we're expanding both port facilities. You can see it going on there at Adelita, Cancrine, and St. Thomas, and the same thing is going on at the container port in St. Croix. We continue to work with Senator Novell Francis on the free trade zone bill, which will open us up into manufacturing and bringing in stuff from foreign places duty-free. We look forward to the completion of the projects at WAPA that brings down the price of energy, which will now allow us to attract more manufacturing companies to the territory. So there's a lot of things going on there, including a $40 million institution by the National Guard that they're building at the St. Croix Airport, which is expanding our flight operations at that airport. I listen to people talk about diversity. I've been in the economic development business for a while, and I've studied it even as a high school student. We've been talking about diversity for a long time. We have a very finite economy. The way we make and multiply what we have here is by investing in our people and giving them a solid education. We have over 30% of our population that lives below the poverty line. How do we get them to make money? Right now is a perfect time in the world, because if you can work from anywhere, why not work from here? A place that's 85 degrees.
Exactly.
But we got some issues now. We got to get these infrastructure projects done, and we got to get a hospital built out to a point where people feel comfortable working from our beautiful Virgin Islands. Thank you, Sarah.
Total agreement. Thank you so much, Governor, for answering my question. Have a great day.
You too. Another question?
Bye-bye.
Go ahead.
Hello, good afternoon. Hi, Lasiba Knight over at the St. Gravis. How are we doing today?
Good, Lasiba. How you doing?
Awesome, sir. So my question centers around our growing jobless figure. I had to calculate the unemployment rate myself the other day, and it's hovering right below 20%. It might have gone over that by now.
Right.
I'm wondering if there's a plan to invest in our job list right now, or ease regulations to help people to get into business. Like you just mentioned, 30% of people in the Virgin Islands live below the poverty line, and a lot of the people that were laid off were working in either seasonal tourism-related jobs or the service industry. So I'm just wondering if there is a plan to get those people back to work and maybe invest in them, like trade skills, that sort of thing.
That's an excellent suggestion, Lasiba. You should reach out to your senator and make sure that they pass the legislation in order to get it done. But on a real note, though, the problem with us is that we don't have enough money here in the Virgin Islands. We need to be importing the money all the time. So it's not as simply as just opening businesses. You need people to go to those businesses and partake. If you've been following the news nationally, I think JCPenney just claimed bankruptcy. A lot of these box stores are going down. What we need to do is be able to work remotely to anywhere in the world and bring in new dollars to the Virgin Islands. We need to get the legislation that allows for people to see benefit here in the Virgin Islands. But simply opening businesses and reducing licenses, it's the same $50 that's circulating round and round in the community. We need to bring new dollars, new money into the community. But we'll certainly look into your suggestion, because it's excellent, on relaxing some of those requirements to enter business and creating some opportunities in terms of finance in order for business owners to start their businesses. I'd like to remind people that we still have all of the programs that were there before. Economic Development Authority has a farmers and fishermen license, has a farmers and fishermen program where you can borrow up to $50,000. They have other money through SBDA. They have loan programs that are being offered, not only the payroll protection, but other bridge programs that are available in the territory. This is a very uncertain time, and we don't know what's going to happen next. So we're in a funny kind of holding pattern as we wait to see if these numbers globally will start to deteriorate and get less and less of new COVID patients. And so far, it's looking real good. Contrary to what the news is saying, you can see the tapering off of this virus. We don't know if it will come back. It looks positive for at least treatments now, and maybe even a vaccine sometime soon. But while we're recognizing this, I also want to recognize that it is EMS week. I want to say a special shout out and thank you to all the EMS personnel and their families. Every single day they go up and pick up patients and subject themselves to not only the danger of COVID, but other communicable diseases, sometimes even gunfire. I want to say a special happy EMS week to my brother, Robert Bryan, who is a EMS at the Department of Health. And I'd also like to say that hopefully next year when we celebrate EMS week, it'll be under fire, and it'll be fire in EMS week. Another provision that we have been trying to move through and trying to get done, trying to keep this community safe. We don't have any more questions?
To add,
Yeah.
And actually, right now, EMS is under Department of Health. Even when it goes under fire, we'll continue that partnership. But I wanted to say happy EMS week to all of the EMTs out there, regardless of where you are in terms of your status. And be safe out there. I know that 24/7 you are on call and you're out there. And we appreciate each and every one of you. So thank you and happy EMS week.
And also to all of those volunteers that serve as EMTs and rescue people, thank you as well. Well, that's all we have for today. Remember, stay safe, stay sanitized. God bless you, and God bless the Virgin Islands. And as usual, stay tuned for the Spanish version of this message in 1 minute.
JP, we say, my boy.
Things have changed. Social distancing is important. Practice non-contact methods of greeting. For more info on how to prevent COVID-19, visit doh.vi.gov.
The Atlantic hurricane season begins on June 1st and lasts through November 30th. Please take necessary steps to protect you, your family, and the community.
Begin collecting supplies such as bottled waters and non-perishable food, batteries, radios, games for children.
Don't forget about your pets and especially your elderly family. Take time now to trim trees, install or check shutters, talk to children about hurricanes and allow them to pack their own go bags.
These activities can help reduce anxiety in the event of a storm. We're a small community.
Together we can ensure our islands, homes and families remain prepared for hurricanes.
Register for Alert VI emergency notification by visiting vitema.vi.gov. Make a plan.
Be prepared.
Stay informed.